So, in state news, here in California, we are seeing a state assembly bill that is an attempt at universal health care coverage in California for all Californians. And this has been tried before, this type of legislation in California, but it did not succeed. And my guest, this interview is pre-recorded, is going to talk a bit about that. He knows quite a bit about it, and the different steps that it has taken. But so the legislation is called AB 1400, and if we just really quick look. I just want to give you a quick shout out or a quick setup here. AB 1400 is the California Guaranteed Health Care for All Act. Assembly members Ash Carla, Lee Santiago, principal co-authors, Assembly members Chu and Ting, and Senators Lena Gonzalez, McGuire, and Weiner, co-authors, Assembly members Carrillo. So we got a bunch of people involved, and this would set up basically Medicare for All on a statewide level in California. So I find it very interesting. Who knows if it's going to pass? Not sure that it's they call it AB because it's an Assembly Bill number 1400. So AB 1400. So right now this is sitting in the Assembly. It's going to be voted on, and it's going to have to go to the Senate and then to Governor Newsom's desk. So right now, this isn't a ballot proposition. This is something that if you want to get involved, you need to pressure state politicians to make happen. Okay, so let's without further ado, let's hear the interview with Walter Heath. Really nice guy, and here we go. Okay, my guest on Political Pain this week is Walter Heath. Walter is a retired Morro Bay resident, but also a volunteer organizer, a longtime volunteer organizer for Medicare for All. And we're going to talk about the statewide, for California, that is, bill AB 1400. But before we do that, Walter, welcome to the show. Thank you for being here with me. And why don't you just introduce yourself to my audience and let them know why you find this such an important policy, set to organize around for yourself.
Sure. Thanks, Joe. Thank you for the opportunity to speak with you today.
You bet.
I come to this issue because healthcare really, by an accident of my father's employment, or a coincidence of my father's employment, was never really an issue growing up. And it became shocking to me to find that people were struggling with this and getting, surprise bills and being bankrupted, just ruined financially. Half of all bankruptcies are related to healthcare costs. And it was shocking to me because we never had that issue. My dad was, in the public sector and had a great health plan through the city and county of San Francisco. And so this is my way of giving back, because it just doesn't make sense to me that it should be so unjust that healthcare should be tied to your employment and completely dependent upon what your employer is offering you, or worse yet, you're underinsured buying a plan from the Affordable Care Act marketplaces with a high deductible plan that really doesn't do you any good for your ongoing health maintenance. So yeah, it really does need to be fixed.
Yeah, and I think it's worth noting there's like a cascading number of problems that we have in the United States from, looking at medical care as a commodity and not like, say, a public good, just from people visit the doctor far less often. They don't become aware of, diseases like cancer until much too late, because for that reason, they put off going to the doctor. But also there's just less access to care and, pharmaceuticals for chronic diseases as well. But so you've been organizing around Medicare for All for 17 years, you told me. And so you've started looking at this new proposed bill in the California Assembly, and that's AB 1400. Why don't you tell me what your kind of initial first impression is of it, and then we'll get into the weeds with it and talk about the kind of broader aspects of starting with Medicare for All as a statewide issue. But what's your first impression of the bill?
Sure. With each iteration of a universal coverage bill that comes through the state, they seem to get better. And AB 1400 is definitely an improved version of the bill that was put in the hopper in 2017, which was State Senate Bill 562. It originated in the State Senate 4 years ago, and now it's originating in the Assembly, because that's where it kind of got stuck. It got stuck in the Assembly. It passed the Senate easily in 2017. So there needed to be some changes, and I think probably the most critical change, although who knows what's going to happen in terms of opposition, is it does allow for physicians groups such as Kaiser to negotiate with the payment entity, the trust fund, as it were, that would be reimbursing the bills, just as Kaiser would negotiate with an insurer. If they did that, they're self-insured, but so that permits Kaiser to continue to exist, and that was their main issue, and they were putting a lot of money in opposition to the bill, and they may do so again. But this is, I think, an improved version of the bill. It addresses some of the concerns that legislators posed to us in 2017 as reasons why they would vote against it. And hopefully that's enough to get it to the floor for a vote in the Assembly by June 4th. That's the deadline in order for it to pass, to be considered in the Senate and voted in the same legislative year. I mean, it can carry over to the second year of the session. Our legislative sessions are 2 years, and it just started in February of 2021. But we'd like it to be considered and passed this year, and not wait for the second year of the legislative session.
Very good. And so, this is basically kind of like Medicare for All on a statewide level. It would offer no premiums, no co-pays or deductibles to all Californians. Now, you mentioned Kaiser, but what would this do for Californians who already have private health insurance? Would this take them off of that and put them onto this system, or would this cover all other Californians? Do you know the distinction there?
Yes, this would do away with private health insurance. There would be one insurer. This is the proverbial single payer. There is one payer negotiating on behalf of all insureds, and the idea is that it would keep costs down, because there's no larger group than all of us. And so, if you want to do business, if a healthcare provider wants to continue to do business, they have two options. That's either accept the state plan as reimbursement or become a completely cash business. So that's pretty much their alternatives. Now, there are going to be, I think probably it'll end up be some limited exceptions. There will be some waivers needed. A lot of people don't realize it because they're carrying around a health card from their employer that has, Anthem or Cigna or one of the other health insurers on it. But there are about 10 million workers in California whose employers self-insure for healthcare expenses, and consequently, they make the rules whether they're going to cover, pregnancy and delivery, or just anything. They make the rules, and so people think they have health insurance from a health insurance company when in fact their employer is self-insuring for healthcare, and that employer is protected by kind of an obscure section in the Employee Retirement Income Security Act of 1973 that says that they don't have to play with a tax-based, publicly funded healthcare system if they don't want to. So something would have to be done about that, or some accommodation would have to be made for employers who self-insure, and there are a lot of them who do that.
Interesting. So that kind of allows them to pick and choose a little bit, like you were mentioning there. I
Yeah.
should say that CalCare, which is what this system would be called, this single payer system, it would have primary preventative care, hospital outpatient services, prescription drugs, dental, vision, audiology, reproductive health service. It runs the gamut. Everything's covered
Yes.
under this, and again, no deductibles and no copays. What are some other aspects of this bill that you think are important? I mean, obviously, we don't want to bury the lead. The most important thing is universal coverage statewide. But are there other aspects to this bill that you think are important?
Yeah, two things. First, to go to what you're mentioning here about, no deductibles, no copays, no payments at the point of service.
Yeah.
What's significant about that is having no financial barriers to seeking care. And as we've seen during the pandemic, that even hours can make a big difference between being put on a ventilator and being intubated and having a less intrusive, less radical course of care. And so, having the experience, through my extended family, I'm third generation immigrant, but there was my extended family very much was dependent upon the federal public health system, and there were regular episodes of people saying, my uncles and my cousins saying, gee, should we really go to the hospital? I mean, can we afford to even step in the door?
Yeah.
Because I mean, you're looking at a 5-figure bill if you step in the door, right? And that's a financial barrier to care. And during this pandemic, that could be deadly. And so the having no financial barriers to seeking care is going to be huge. That's truly healthcare as a human right. When someone, who isn't feeling well can just go and find out what's going on without being worried about being bankrupted. And I'm not kidding here. There was a story in the New York Times today of a gentleman in Texas, and it's a perfect example of how people fall through the cracks. This man in Texas, it's a New York Times story today in today's edition. Went to the hospital, couldn't breathe, shortness of breath. He'd been experiencing the symptoms for a couple of weeks. They put him in the hospital. They gave him a COVID test. The molecular test came back negative. The antibody test came back positive. He was sent home because they sent him home with some oxygen, some supplementary oxygen after, about a week, I don't know, a couple of days stay, I think it was. It's like 2 days, 2-day stay, as I recall. And they sent him home saying that, he didn't have coronavirus. Well, if they had diagnosed, because the test came back negative, if the coronavirus test had come back positive, his medical care would have been cared for. Because it was negative, he got a $22,400 bill for 2 days in the hospital. And he's 64 years old, 23 days away from being eligible for Medicare. And not only that, to make matters worse, he slipped up, and instead of canceling his private insurance that he bought through the Affordable Care Act, instead of canceling that on the day that he became eligible for Medicare, he slipped up and made the mistake and canceled it a month too soon. So he was totally without insurance, and now he has a $22,400 bill. He probably had coronavirus. He probably had COVID because of the positive antibody test.
Yeah.
But because of that judgment call made by that hospital, he's on the hook for a $22,400 bill.
That's insane.
Isn't that so? Yeah.
Yeah.
Yeah. To go to the second reason, though, that I think is significant about this bill is that this is about health equity. What we're finding is that people of color are being infected and hospitalized by COVID-19 at a rate 4 to 5 times greater. In Santa Barbara County, it's 5 times greater than whites. And that has a lot to do with the fact that there are not enough facilities in a given place, or the facilities are inadequate. What CalCare would do is it would finance hospitals through global budgeting, much in the same way that we finance our fire departments. because the health events for a population are very predictable. It's one of the reasons why for-profit health insurance is so successful, because for a population, you can know from historical data how many heart attacks you're going to have within a range, within a predictable range, how many broken legs, how many gallbladders, how many appendix removal, that all that is very, very predictable. And so, whereas for you and I, we don't know, what's going to happen to us in any given year. So, with global budgeting for hospitals, it will level the playing field so that hospitals in poorer areas and in rural areas in the broad swath of the middle of the country where people have to drive 2 hours to get to a hospital, needs can be assessed and resources can be funded. And it will just level the playing field, because it's no longer, hey, let's put all the hospitals in the places where affluent people are, because that's where we can make our greatest profit.
Absolutely. And we already see this across the country in the way that Medicare, funds rural healthcare already across the country. We wouldn't have a lot of clinics in rural areas if it weren't for Medicare.
Honest to goodness, Joe, if mainstream Democrats would just get off their duffs and back this, honestly, they would bring red state America along with them, because people in that broad swath, that broad middle of the country that votes Republican, they are suffering. And one of the basic things, maternity death rates are greater. Just in general, it's much tougher because, a hospital's a 2-hour drive away. Can you imagine if me in Morro Bay, if I had to drive down to Cottage Hospital in Santa Barbara, it's about a 2-hour drive.
Yeah.
Wow, that's rough.
In the middle of a health emergency, it just doesn't make any sense.
In the middle of a health emergency,
Yeah.
That's right. So, mainstream Democrats have to, every single co-sponsor of the national bill, save for 6 who retired, the remaining 112 who signed on to the National Medicare For All bill, they were all reelected. All of them. Every single one of them.
Yeah, well, you're talking about the proverbial, the age-old, at least in my lifetime, struggle, which is these mainstream centrist Democrats. How can we get them to actually, take a left position? But to kind of use that to pivot to something that I think is prescient to discuss, like in regards to Medicare for All and AB 1400, is when California does something. As much as you hear red states and the rhetoric against California and all these things you hear, when California takes a step, the rest of the country turns its heads, right? I'm thinking about fuel emission standards for cars. And part of it is a function of our population. We have such a massive population, but also our economy. Marijuana legalization, regulation. We're not, the first to, approve recreational use, but definitely one of the first for medicinal use, and other big kind of policy propositions that get tried out in California first, and once they catch on and they work and people see what it's like, it tends to catch on across the rest of the nation, or at least from a federal level it might seem more plausible or possible to do. What do you think about that?
Oh yeah, for sure. Very hopeful. As a matter of fact, Medicare for All in Canada was started in a single province, in Saskatchewan province. And Tommy Douglas, who was the provincial governor at the time, and Kiefer Sutherland's grandfather, by the way,
there you
go. Got that passed through the provincial legislature there. And then it spread until finally it was adopted by the entire country. So yeah, you're right. California is 10% of any national market, just from the get-go, by virtue of our population. It's huge. And during the early days of the pandemic, when personal protective gear was in short supply, Governor Newsom set up a purchasing consortium for the entire Western states. Mm-hmm. Think about that for a second with respect to healthcare. If we get this passed,
very interesting. Yeah,
there's potential there as well. just to kind of spread it around. At one point, through the Republicans managed to really kind of drive a stake through its heart. But in the Affordable Care Act, there was a provision for nonprofit cooperatives to function, and Nevada, through the United Food and Commercial Workers Union, which is huge, it basically is the union for many of the casino workers, was prepared to start its own health plan, a nonprofit health plan. And California was, if they had been able to get it started, and there was money set aside for, because you need to be capitalized initially from day one for anybody who gets sick and submits a claim. There was money provided by the federal government to get you started. Then you'd pay that money back once you were going concerned. The Republicans took the money away, largely because California was saying, as soon as you get your nonprofit co-op set up, let us know and we'll join it.
Fascinating. Well, from a budget standpoint, like, if this isn't free healthcare, it's free at the point of service, but it's paid for through taxes.
Yes.
What is there anything in the bill that kind of illustrates, or anything that you're aware of that shows what this would mean for the state budget, what it would mean for taxes, and just, basic, most individuals, how would they be paying for this? What would it mean for their state tax bill every year?
I appreciate that question. Thank you for asking it.
You bet.
The bill is not written with the financing mechanism in there. They're leaving that for the appropriate, after it passes Assembly Health Committee, it goes to appropriations because it involves money. And so they're leaving it to the Appropriations Committee to discuss how to best pay for this. Now, generally speaking, we pay for it all now anyway. Each of us, either through the crazy high prices that we pay for healthcare in this country, even though healthcare utilization is down and has been down for years, right up to the point of the pandemic, of course. But so healthcare utilization is down, prices continue to go up. We subsidize health insurance companies to the tune of $685 billion in 2019. And our Defense Department bill, our Defense Department budget for all the branches of the service and the Pentagon and everything this year is $740 billion. I mean, it's outrageous how much we are subsidizing the health insurance industry through our tax dollars. And then we're also paying for our own health care as well, mostly out of pocket. So there is no magical source of funds being pumped into the system. We pay for it anyway. So why wouldn't people want an entity with maximum purchasing leverage negotiating lower prices on our behalf? The savings will be considerable, and it will be apparent to people very quickly because we're spreading the risk over a greater number of people. So that means each person pays less. It's the ideal way that insurance should work, but because we have a for-profit system that cherry picks its customers based on how healthy they are, we're not getting full value for our money right now, but we're paying for all of it. We'll just be paying less. I'm confident of this. I mean, in 17 years, I worked really hard and I read a lot to be an honest broker about this. And I would not sell anybody a bump steer on this thing. It's going to cost us less in the long run.
Wow. Yeah. Well, when you talk about how much we're already subsidizing private companies, talk about double dipping. That really is something. So, Walter, like, what can your average Californian, or anybody for that matter, do to get involved with this? I mean, this is not a ballot proposition. This is all within the California state government.
Yes.
I know our local assembly member, Republican Jordan Cunningham, in the 35th Assembly District, I remember he spoke against the Senate bill during his reelection campaign
Yeah.
2 cycles ago. And so, but I don't think we really need to lobby him that hard when the Democrats have a supermajority in both houses.
Yes. Correct.
But what can people do to organize around this and try to get it passed on the state level?
Well, they can go. I wish I had made up a little sign. They can go to Medicare numeral four, number four, just Medicare for all.org. The kind of the central coordinating entity for this campaign is the National Nurses United and California Nurses Association, and you will come upon their website. So it's Medicare number four all lowercase, no space .org. To get involved. And what we're doing right now is we are texting texting the moderate Dems in the legislature, because they're the ones who have held us back. It's the moderate Dems, and we need to convince them that their constituents really need this. This is a kitchen table issue for everyone. It's the kind of thing that you talk about, over dinner, and usually it's of an emergency nature. And it's awful to see how families have been affected by this COVID pandemic. It's awful to see how families have been affected by the opioid crisis and the fact that we don't have enough mental health services in our country. These are the kinds of things that can be discussed openly in a transparent manner, not in a boardroom among people whose interest is profit. This would be, it would be a transparent process to discuss, hey, do we really need, 5 MRI centers in a town of 20,000, that kind of thing. Shouldn't we have more mental health services, that kind of thing? And that information regionally gets passed along so that we can actually fund for the healthcare needs of our people.
Yeah, well, and absolutely. I mean, and if we were to just talk brazenly politics, this is a political matter. I mean, if these centrist Democrats could realize that this isn't Ronald Reagan's America anymore, even Trump didn't win by a popular vote, and he lost resoundingly. And the Democrats would deliver for people. I'm thinking $15 minimum wage. I'm thinking, something as grand as a New Deal geared, not to mention the Green New Deal, as Medicare for All. We could start here in California, and California, ooh, scary. But then, once we move it out to the rest of the country and roll it out, I think it really could ensure generations of voters for the Democratic Party, and allow especially like you said, when you see all of these House members who endorse Medicare for All get reelected, every single one, then you can see a generation, kind of like going back to the 1930s, a generation of Democratic support and voters, and a new blood moving into the party to kind of get the wilt off the leaves a little bit, I guess. But
it would be a game changer, Joe.
Yeah,
it truly would. I mean, when I travel to these countries that that have publicly funded health plans, they think we're crazy. I mean, they really do. They think we're nuts in this country, and their systems create such solidarity in the population and so much ease. All the worry is gone. People can go ahead and live their lives the way that they want to live their lives, not having to worry that if by some chance they happen to get sick, they're going to be ruined, financially, or their families will be ruined. So yeah, it's something that we really need to do. It really is a fundamental game changer, just for everyone.
Yeah, absolutely. And, I like to talk about this issue when I'm talking with someone on the right, and kind of frame it in the language that they understand, where I say, boy, I wish I had the freedom to not be yoked to a private company or a boss or whatever to get my health care. I wish I could just have my own small business and have my health care covered through taxes. But Walter, I know you got to get going here in a minute. So I want to ask, is there anything else you can think to add? And again, I really appreciate you coming on here and talking about AB 1400 and Medicare for All. What is it called? CalCare, which would be a
Yeah.
statewide version of it.
Well, thanks again, Joe. I mean, for this opportunity, and I hope that I can come back and give you updates on our progress.
Hopefully, good updates. Yeah.
Yeah. Oh, yeah. Yeah. This is really a passion of mine, and there are all kinds of ways for folks to be involved in very accessible ways, comfortable ways that you don't have to operate outside your comfort zone to make a difference. So go to Medicare for All, number 4 all.org, and just get involved today. And you can also reach out to me if it's okay to give my email address. Is that okay?
Sure, go for it. Yeah,
sure.
I mean, it's up to you. You're doing this on the internet. You know what you're getting yourself into.
It's okay. It's okay. It's walterheath@gmail.com. HEATH, all lowercase, no spaces. No, I'm happy to talk to anybody about this issue.
Very cool. Well, thank you for talking to me about it today, Walter, here on Political Pain. I appreciate your time, and thanks again for coming on.
Thank you, Joe.
You bet.
Stay.
All right, folks. Isn't that great? So, AB 1400, he let you know, Walter let you know a couple ways that you can get involved. But I would be remiss if I did not mention that you can also check out DSA San Luis Obispo. Full disclosure, I am a member. Check it out. You can find them on Instagram at DSA_slow. But if you go to their Linktree link here, you can find a bunch of stuff. You can join the mailing list. But they are going to be doing phone banking March 13th and March 14th. So you can get involved, sign up, and get involved in phone banking to Pressure Assembly District 16 is one of the swing districts. So you can get involved in local politics and put some pressure on local politicians to let them know how important this would be to you and yours. So very cool. Thank you, Walter Heath, again for coming on the show. AB 1400. I think it bears repeating, everybody, that California in a lot of ways leads the nation. We're one of the largest states by population and economy, and when we do something, the rest of the country takes a look. And yeah, the right may shake their fists, but many California policies became national policy. We see how close now we are to possibly getting ourselves, a full federal legalization of marijuana. That is a big time California policy right there. So it's important to acknowledge that and take a look at it.